end about Census. We have our Lieutenant Governor here with us, Bethany Long, who's been heading up our efforts in Delaware to make sure that everyone is counted, so Delaware in particular gets resources that are due our state from the federal government mostly. So we appreciate her work, and we'll hear from her towards the end of the presentation today. We also have Jamie Mack. He's back with us. He's the Division of Public Health's Environmental Health Director. He is the man on the ground who helps businesses and organizations and venues successfully conduct their business and operate. He's going to talk about new guidance that the Division of Public Health has come up with around athletics and sports. We have had a series of guidances out on sports over the summer as youth sports in particular have come back online. We've had activities up and down Delaware, from sports at the beach to DE Turf to the 76ers Fieldhouse. Some of those contests and some of that activity was done very safely and very consistently within the guidance and the rules, and some of it not so much. And we're going to talk a little bit about that as well. As we think about sports, really the thing where we see the most problem is with spectators and off the field activities, both of athletes and spectators. And so that's an area where we really need to focus as we encourage more of our athletes to get back on the field, back on the courts, and active again. It's particularly important for their mental health. It's such an important activity for our families. And those activities that take place out of doors, we know, are safer than those that are indoors. And so we'll continue to focus on the precautions that need to be taken in order for our athletes to participate. And a lot of that, again, goes to the activities of spectators and fans in the stands. I took time over the weekend to look at a high school football game that was televised on ESPN2, one of the ESPN channels, a high school game that was done in Alabama. And that's not the way we're going to propose to do it here in Delaware. Very little mask wearing among the athletes on the field. The coaches weren't that compliant with mask wearing, and spectators in the stands were not either socially distant. Many of them wore masks, but certainly not to the level necessary. So we'll talk about that. Yesterday on the White House, the weekly White House call, we heard from Dr. Anthony Fauci again. And Dr. Fauci's main point is that we have the Labor Day weekend coming up, where there are lots of parties and family gatherings around cookouts and the like. And these are just the kind of activities that unknowingly take place, and that the viruses pass one person to the other. We let our guards down a little bit. We probably don't wear face coverings or masks in a family setting like that. But when people are close together, and particularly when alcohol is involved, people start to behave in a way that's not consistent with protecting the spread of the virus one person from the other. And so this is going to be a big test, as he said. This is from one of the experts, public health experts at the national level, that if we can get over the Labor Day weekend successfully without a lot of COVID-19 spread, then we're really going to be set up well as we try to get more children, more students back in schools for in-person learning. We're in the yellow stage here still in Delaware, hybrid learning. A few districts have ventured forward with hybrid plans where they have children in front of teachers part of the time and remote learning. Most of the districts are learning remotely initially, taking advantage of some of the investments that we have made as a state in broadband and making sure that every student has a chance to get rich instruction. And the goal, of course, is to get more and more students in classrooms on an in-person basis, because we know that kind of instruction is most effective. And so that's our goal overall in the fall, as well as to get as many workers back on the job as possible. We do have some announcement there with respect to seating at the bar and restaurants in the beach areas, which for several weeks now have been closed. So it's a big day. The focus again is on clients compliance. The focus is on mask wearing. The focus is on social distancing. The focus is, as we approach the Labor Day weekend, really being smart, and not having a big picnic with 30 or 40 or 50 people that could become a big spreader of COVID-19 if one of the folks that's there at the picnic happens to have the virus and maybe is asymptomatic. We've seen a lot of that across our state. A.J. Shaw, who is not with us today, continues to do a really good job as our point person with testing, as we've ramped up testing across the state, Newcastle County, Kent County, and Sussex County. We still are seeing higher cases, new cases in Sussex County, actually some spikes this week. And so with that, let's go to the data dashboards. Again, we're closing in on 18,000 total positive cases, significant number of negative tests, and sadly, again, 605 total lives lost. That number has not increased by much of late. Of course, everyone is a precious life. We have seen a little bit of an uptick in hospitalizations, nothing to be too concerned about based on what we see and hear from the hospitals. Our percent positive is now ticking up a little bit above 5%. We want to be below 5%. We've had a couple days with a high number of new cases per day, and 96.3 again as a 7-day moving average is higher than where we want to be, and we want to be going the other direction. We'll see that in a minute. And of course, we want to be under 5%. With respect to the positive cases, we have seen additional upticks in Newcastle County there with now 8,200 positive cases. Kent County more stable this week with 2,600 or thereabouts. And then in Sussex County, of course, with almost 6,400, and on certain days this week with some spikes there. So certain activities, this I understand wasn't just beach activity where we see a lot of positive cases associated with summer activity in restaurants and congregate settings there in the beach communities. Again, if you look at the breakdown by population or by cohort, the demographic group, you can see that the young adult group still continues to have the highest percentage of cases and continues, unfortunately, to lead the way in those new positive cases. If you look at the 14-day view, again, hospitalizations trending up a little bit, again, still at a level significantly below the high point back in April at 337 on April 27th. Today, we're at, I think the total number was 62 for that. With respect to new hospitalizations, admissions, it tends to be up and down, as you can see, kind of down over the weekend, maybe a few extra ones on the week. Our percent positive, again, is trending above 5%, not where we want it to be, and that's driven, obviously, by new positive cases, is the bottom far left. We had the one day there on the 27th with 127 new cases, and we want to be in the 70 new cases per day and fewer. So we need some work to do there. If you look back over the last 90 days, you can see the peak and the incline, the increase after mid-June and into July 4th weekend. We see cases trend up there. If you look at the percent positive, you can going all the way back to prior to April the 1st to the beginning. You can see that very significant peaking where we are at 44% positive on a daily basis, and then declining over the next several months. We want to get even lower than where we are today so that, again, we can bring more children back to school for in-person learning, get more athletes out on the field and into the gyms, and enable more workers to come back to work. Our data dashboard for personal protective equipment, all the vessels are full, meaning we have a full supply of of gowns and glasses and surgical masks and the like. We expect that this inventory to be stressed a little bit as schools reopen, but right now we're looking pretty good. And on our White House call, all indications were that the stockpiles of that personal protective equipment is pretty good at this juncture. So we're clearly 2 of the 3 criteria for opening schools are in the yellow scenario, so minimum to moderate spread. We're kind of flattening out in that minimum to moderate spread. We want to trend down so that we have 2 of the 3 criteria that light up as green, and we can move more children back into classrooms. So many of the districts have decided to go with remote learning. This scenario number 2, the yellow scenario, enables a hybrid mix of in-person, in-classroom learning and remote learning as well. Many of the districts who have the hybrid model are allowing parents and families to choose in-person or remote learning, and they're also dividing up the week and days in the week to in-person and remote learning. So more work needs to be done there. I know the schools and the districts are working on that. Some of our private schools are opening in a more in-person status, and we'll be, I'm sure, learning from each of those as well. So we have, as I've said all along, that every business has sacrificed over the last 6 months with some of the stay-at-home orders and closures and reductions in the amount of people that can be in an establishment. And so we have initially set up the help loans and part of the PPP CARES Act funding to support small businesses in our state. We now have applications for the relief grants, which applications are due and available September the 8th, not due September the 8th, but available on September the 8th. So any eligible business that has had significant loss of revenue because of COVID-19, you need to learn more about these relief grants. It'll help you get through this and on to the other side. We've also submitted as a state a major disaster declaration to recover some of the funds from the federal government for the recovery from the August storms. DelDOT and the utilities and other agencies did a really good job in responding to the storm. I know some folks were out of electricity for an extended period of time, but given the number of trees and electrical lines that went down, that cooperation between the public agencies, particularly DelDOT, Dover Electric, and Delmarva Power, really responded well to that. We're going to talk a lot today about playing safely, our updated guidance for sports. If you think all the way back to the initial guidance back earlier in the summer that applied to moderate risk sports that were allowed to continue to have competition through the summer. And I mentioned you saw Little League baseball and softball. You saw soccer tournaments and field hockey. You saw some lacrosse tournaments, I believe, that were allowed in basketball in certain venues. And they were operating under guidance that the Division of Public Health had come out with earlier in the spring, or I guess the beginning of the summer. At the time, they had not developed criteria for higher risk, higher intensity contact sports like football, wrestling, at that time lacrosse, and some of the others you'll see in a minute. Today, the Division of Public Health is making public the guidance for those high-risk sports, and at the same time, trying to simplify the guidance that was earlier made public for moderate risk sports. And so the main thing is to encourage all athletes, coaches, parents, referees, everybody involved in the event to take the guidance and the guidelines seriously. And the most important thing is to wear a mask. Whether you're an athlete competing, and I must tell you, when I first saw this first principle, everybody wears a mask. If you want to play, you wear a mask. I said, there's no way. I played football, in Pee Wee, at CYO, in high school and in college, and coached at the high school and college level, and I couldn't wrap my head around how you could play football with a mask on. I talked to some of the football coaches and football people in our, including my good friend Paul Schweitzer, who was a great football player himself and comes to the sport now through his activity as a trainer and as a physical therapist. And he was convinced that there were mechanisms that they could use to protect the athletes. And so public health has come out with these guidelines, and Jamie's going to talk about those, and each of the sports will determine what they can do and how they can protect their athletes and their spectators. One of the things that's very clear in everything that we've done is it's not so much the competition on the field as I looked at the various activity over the summer, and we saw basketball, I saw basketball and outdoor football training in the field near where I lived, basketball in the 76ers field house, baseball up at the Naaman's Little League, and it's really following the guidelines that we put out. For baseball, not keeping the players separate in the dugout, not wearing face coverings when you're not on the field in those cases. And so our ability to get more students and more players on the field, and we have lots on the field already outside of the context of high school sports, and then we've got to get everybody to take the guidance seriously and to follow through. And mostly it's about wearing a mask and keeping social distance. If we can't do that, then we can't have the sports safely, and we're going to have to shut them down, because we can't afford to go the wrong way. Just like this, as we go into the Labor Day weekend, we can't afford for people to let down their guard at a picnic, a family picnic or a neighborhood picnic, and then we have a little COVID-19 outbreak. We can't afford that as we try to get our kids back to school for in-person instruction, as we try to get more athletes on the field, as we try to get more businesses open. It requires all of us to follow really simple guidelines and simple precautions, and the most important is to wear a mask. You know, and wear a mask when you're in public, wear a mask when there are other people around, wear a mask mostly to protect others in the event that you have the virus and may be shedding the virus without even knowing it because you're not symptomatic. I'm convinced that we can do it. I'm convinced that we can allow additional activity in bars and restaurants. I'm convinced that we can allow more athletes to be participating in sports. I'm convinced that we can bring more children back into schools. I'm convinced that we can reopen safely, underline and underscore safely. And to do that, it's not going to go back to the way it used to be. It's going to be a situation where we're adopting a new set of guidelines, and the most important part of that is wearing a face covering when in public. And so with that, I'm going to turn it over to Jamie Mack and first thank him and his team for the incredibly difficult work that they've done over the last 6 months, particularly recently as we've tried to reopen businesses up and down our state, as we've tried to get compliance with the guidelines that the Division of Public Health has put out there, and as we move forward with these new guidelines on sports and with new guidelines on restaurants and bars, that we can actually take the actions individually necessary to do it safely. Jamie Mack.
And thank you, Governor. As the Governor mentioned, DPH initially issued guidance for sports throughout Delaware in mid-June of 2020. We've looked at a lot of tournaments and leagues and events. We've worked with a lot of facilities and a lot of organizers, and we're looking now at this new version as a simpler way for us to emphasize the more important pieces of, the guidance that we're trying to keep in place. And as the Governor mentioned, face coverings are absolutely the most important. The social distancing is also very, very important. And one of the things that we're emphasizing with this new guidance is that applies to everybody. It's not just the players, but we need the coaches, we need the referees, we need the spectators to all take this seriously so that we can continue to enjoy sports and have kids out on the fields. And We've also shifted, and we now are looking to both facilities that are holding these events as well as the team leaders, the coaches, to take responsibility for this. It's not just the organizer of a tournament that we need to hold accountable for the actions at that tournament, but we need to work with the facilities and make sure that everybody is working with the same goals in mind. So the new policies, the new guidance, it's based on a risk-based criteria. So there's general guidance about face covering, social distancing, but then we also have 3 risk categories. This being the low-risk category, which are sports where there's almost no physical contact. There are things that reasonably can be done with social distancing or are just done individually. If we look at the medium risk, that's where we'll see, a lot of the sports that we're talking about. And these are sports where physical contact is not the point of the activity, but it's definitely a part of it. Whether it's basketball or, lacrosse, hockey, where you might be doing a man-to-man kind of defense and you're playing closely to other folks, or flag football where you're trying to, grab that flag to get the down. There's a lot more potential for contact than there is with the low. And then we get to the high-risk activities, and these are the ice hockey, the wrestling, things where the physical contact is much more a part of the activity, if not, the whole activity, as with cases like wrestling and boxing. And these are activities where we're going to be wearing face coverings, or we're going to have to work with organizers and facilities for rule modifications to limit physical contact. Now, the one last thing I just want to say about that is, we need to keep in mind that these sports up until this point had not been allowed. So this new guidance provides a little bit of flexibility in that some of these sports, if we can work with the organizers and the facilities to approve plans, we're going to allow them to resume activities.
Yeah, if I could just interrupt there, Jamie, and just to underscore that last point, which is up until now, these sports have not been allowed because we hadn't developed the guidance and the restrictions because of the level of contact involved in each of them. Mm-hmm. And so now for the first time we do have guidance here, and it mostly centers around mask wearing, protecting, keeping those respiratory particles from escaping one player to another.
So face coverings, that's going to be the key for, just about any sport. If it's a sport where you can maintain your distance, there's some flexibility that would be allowed there. But for the high-risk sports, it's going to have to be face coverings, or it's going to have to be modified play. And we're not being prescriptive with this. We're not describing how to do face coverings in football. We're looking for the facilities, the tournaments, the community to help us figure out how to do that. And I know that some ideas for football have already been floated out there. It's a gator type face covering that's able to go over the face mask, and we might be able to adapt that to hockey, some of the other sports. So that's the type of engagement that we're really looking for with this simplified guidance. We don't want public health to figure out how to do these sports. The players, the coaches, the families, the communities are going to be much better positioned to tell us how we can safely do it. And that's for the athletes. I got to go back to the coaches, the staff, the referees. I've seen in some of my site visits that I've done to DE Turf and some of the other facilities, the players are doing a great job. Then they come off the field, they all cluster together, and the coach gives them a speech. Well, if that coach is only standing 3 or 4 feet away and he's yelling to be heard over the crowd, we're undermining a lot of the other things that we're doing to be protective of our players and ourselves. The referees, I hate to do this, or we hate to talk about this, but the whistles are a problem. We need referees to be in face coverings because they're going to be yelling at the players, at the coaches, just to be heard. That increased volume is going to increase their expulsion of viral particles, and it's going to increase the distance that those viral particles travel. So we're going to need to have them in face coverings, and we're going to need to get them creative and innovative to figure out what they can use besides traditional whistles. And then the spectators, if you're walking around the facility, if you're talking to your player, if you're talking to the coaches, you should be wearing a face covering. Really, unless you're seated with your family and are able to maintain different distance, you should always have that face covering on. The social distancing becomes another key to complement the face covering use. If the players, if they're able to be 6 feet apart, they can take a break from the face covering, pull it down for a moment, catch their breath, do what they need to do. Players and coaches, there's a lot of families in these sports. If the coach is working with somebody from their household, their kid, they can get close to them. They don't have to be as careful, but with all their other players, they've got to maintain that distance, or they've got to wear that face covering. We're going to continue the restrictions on benches and dugouts. That was something that we saw as a challenge when we initially started looking at sports. We saw a lot of crowded benches. We saw a lot of crowded dugouts. We can't have that. We've got to have people distance. We've got to be using face coverings. We've got to continue to be vigilant with everything that we're keeping in place if we want to be able to continue seeing sports come back, and as the governor mentioned, seeing kids come back to school, and just, the other businesses and activities that we're talking about. And then one of the things that's overlooked sometimes with sports is the kids' gear. We've seen places where the kids are distanced, the coaches are wearing face coverings, everything's going well, and at the end of the game, all the kids rush back into a little huddle to pick up their gear. We want all that gear to be spread out so that when kids have to access it or go back to pick it up, they can grab it and not be within, the 6 feet of other folks. We talked about face coverings. We talked about social distancing. We can't skip the hand washing and hand sanitizing. We're looking for everybody to wash their hands before and after games, and that goes back to the 20 seconds that we've all been talking about for a few months now. If there's an opportunity during the game to hand sanitize or wash your hands, it's great to do that, especially if it's a game or a sport where you're sharing equipment, passing a ball back and forth, sharing bats among baseball players. Anytime that we're sharing equipment like that, we want to make sure that we're doing that extra step of sanitizing our hands. For the facilities, we're looking for them to frequently disinfect the high contact surfaces, light switches, doorknobs, railings, where are people coming in, touching every few minutes. We want those cleaned at least every 2 hours. For the facility as a whole, we want a disinfection and cleaning at least once a day. Now, there is a bit of a caveat to that. If a facility is not used every day, then we just want it cleaned, based on the schedule for their activities. Now, with this guidance, we're still looking, as I said, we're looking for everyone to be engaged with DPH to help us figure out how to do this. So we are looking for any facility or organizer that are going to be doing indoor activities. We're going to want them to submit a plan to DPH to be approved before they really begin those activities. That's going to go to hspcontact@delaware.gov so that my team can review those plans, work with facilities and organizers to get these sports going safely. We're talking about groups for these teams. We want to limit to 15 people. Some of the sports, there's going to be different risks for transmission, so we don't want large groups. We want to keep that limited so that we can reduce any impact of a positive within that group. And we want those to be what we call stable groups. We don't want 15 people each week. We want that group to be stable through the season so that, again, we can limit the impact of any of those positives. We're looking for the facilities, the teams, to develop things like arrival and departure procedures. They're going to have to do health assessments, may have to take temperatures, and we're going to want them to have plans in place for how to deal with folks who may develop symptoms during a game or practice or anything like that. And we're going to continue to discourage shared use of locker rooms, water fountain, and shared equipment. So a lot of the general guidance remains the same as to what we've all been talking about for the last few months. There's extensive signage that we want to see up at facilities to remind people to stay home if they're sick, constantly remind them about the social distancing and face coverings and other activities. No tournaments or indoor activities without DPH plan approval. And then one of the new things is the facilities, we want them to identify a facility COVID coordinator. And that's someone that the parents, coaches, anyone can go to with questions because they have symptoms or to deal with. And it's also someone that can serve as our point of contact with the Division of Public Health. And through all of this, one thing that we constantly remind people is if you're not feeling well, stay home. Going out to that one game when you're not feeling well is not worth having a positive come up and the impact that it might have on you, your team, the facility. So I want to switch gear real quick for just a couple of slides. We've also been doing a lot of enforcement activities, and so we're now going beyond sports to food establishments and restaurants in general. We had previously talked about doing an increased enforcement push in August, and I'm happy to say that my team was able to do over 400 on-site compliance checks in food establishments and other businesses over the last month, and we were not as patient with some of the facilities as we had been in the past, so we have now issued fines, and we've taken some other enforcement actions. In at least one instance, we walked into a place and the conditions were concerning enough that they were closed on the spot. And the facility was cleaned out with the assistance of the local police department, and they were allowed to reopen once they had, a better handle on things. Face coverings continues to be the most common complaint and the most common violation. Social distancing and capacity, those are things that we're hitting on, but we're starting to see a lot of the facilities take more responsibility for that. And then we still need to see everyone hand washing, hand sanitizing, face coverings, and we want to make sure that all of the facilities we're working with, all the businesses still have the signs and the floor markings up. Unfortunately, in some places we've had them up so long that they need to be replaced. But a lot of places, they're just used to seeing their signs, may not think about that. We need to get people to start to replace some of the signs that have worn out, maybe not have the most up-to-date information, especially the floor markings. We're starting to see a lot of those have just worn off over time. Now, a month or two ago, our focus was the beach areas. And now we're focused more on some of the college areas because we are starting to see some of the student population come back. We're working in those areas. We've been out in the Newark area the last couple of weekends. We are focusing more on nights and weekends. A lot of places can do a great job during the week, but once they get crowds starting to come in, things get a little tougher for them. So we want to make sure that we have those visits done as well. We're still always going to look to provide information on that first visit. The second visit, we've done fines, we've done closures, and as I said, sometimes we go out for that first visit, it's bad enough that we have taken action right away. So there is some good news. In the 400 plus site assessments we've done in the last month, we've seen over 150 with no violations. And talking to my people the last couple of days, we've recognized Cafe Gelato and Homegrown in Newark as doing a great job. Easy Speak in Milford has been doing well the last few weeks. And then One Coastal in Fenwick Island, the inspectors were very complimentary to them on the last inspection report. And then I think we can end with, more good news in that because of some of the improvements and the seriousness that we've seen the beach facilities take, some of the precautions that we have in place, we're looking at reopening service at some of the beach bars, some of the zip codes that were closed down a few weeks ago. Now, there's going to be some restrictions. We're looking to help them do this in a safe way. So patrons will be able to sit at a bar to get service in the zip codes that were previously not allowed to do that. They must have a reservation. They must order food. This isn't a situation where we're just going to sit and have a few drinks. We do recognize that maybe the initial shutdown in that area had a heavy impact on some smaller establishments that rely on patrons sitting at the bar for dinner as part of their table service, essentially. So this allows them to get back to some of that, essentially have a few more seats in the facility. And the seats at the bar, they still must be distanced. It still must be just folks from the same household, and then all the other guidance would still apply. So, and again, any complaints, concerns related to businesses in Delaware, they can be sent to hspcontact@delaware.gov. And just to go back to, that is the same address that any of the plans for indoor sports or tournaments would be submitted to as well.
So thanks, Jamie. Really great work by you and the folks in your division with those 400 checks. A lot of good compliance going on, and then a lot of really non-compliance. That's really concerning because it affects all of us. And so we do have some good news, as you say, in terms of reopening a bar service for somebody that's come in to eat, as well as to have reservations. But we've also seen with the enforcement that you've closed places down. I know I saw a report out of Newark the other day that they broke up a party of 50, 60, 70 young adults that was out of control and violated the new city ordinance in Newark. And we're just going to have to be a little bit harder on enforcement as we have, and ramp that up a little bit, because we have all these folks that are following the rules, that have compliance within their establishments, that get hurt by the few who continue to thumb their nose at it. If you do thumb your nose at it, then we're going to fine you or close you down. We expect this weekend, again, this is a test for us. I know that people can pull together and follow the guidance. And then it really comes down to wearing a face covering. And it's a simple thing to do that's so incredibly protective. And if it's that versus not allowing children to go back into classrooms, not allowing workers to go back to work, and all the other factors, all the other consequences of increased COVID-19 spread, it's certainly an easy sacrifice to make to wear that face covering. So Jamie, to you and your team, thanks for all that good work, and we look forward to seeing compliance from the beaches all the way to northern Newcastle County. Today, we're joined for the last part of our conference today by our Lieutenant Governor, who has actually had a very important role in our COVID-19 outreach, particularly to the homeless population and to our outreach in the poultry worker outbreak back in April, where we saw a really serious outbreak there, working with community partners and making sure people got tested and isolated, and now working to make sure that every Delawarean gets counted so that we get our fair share of federal funds. A deadline has been set, and we're coming up to it, and we need to get everybody signed up. Madam Lieutenant Governor.
Thank you, Governor Carney, and thank you for having me here. And I appreciate so much the leadership your administration has put forth, and to our Division of Public Health as a public health nurse. I can tell you we're very proud of Delaware and the efforts of everyone. And building on the conversation earlier, whether it's our schools, our infrastructure with public health, Governor, we know that we need to have the funds. And part of Delaware's opportunity to have increased funding lies in all of us in this state. Every one of us, Delaware counts. We have to count ourselves in the census. So our Census Complete Count Commission, which I have the privilege of chairing, that our governor created through his Executive Order 23, really has brought some key players in our state together, both the private, nonprofit, the business community, and we've really worked hard trying to bring in special populations, communities that are hard to count. And it really matters when we're talking about COVID and schools and roads and the problems that we're seeing now, in our country and in our state, and the census matters. And so our General Assembly, working closely with both our city of Wilmington here and Newcastle County and Kent and Sussex, and First State Community Action down in Kent and Sussex, have worked really hard. Governor, we put a plan into you. It was really well thought out, and something called a pandemic occurred. And it's kind of changed our plan, and that's why we're here today. We literally have 30 days. And we're hoping those who are listening, those of you who are in the business sector, those of you who are grandparents or parents at home, please do the census. And why do these census data matter? Why? Because it really affects our political districts. It draws out how many individuals we get to send to Washington, D.C. We have our lone congresswoman now, your local districts, and then also distributing funds. The money matters. This is things from your lunch money to your Medicaid to your crop insurance for those of you in Sussex. It matters. So we need to distribute the money, and we're falling behind in the money that we are receiving based on the fact that we haven't always been counted. And so it informs a lot. And Governor, our dashboard that you shared and that Jamie shared earlier, all these data come from My Healthy Community or from our census. So we really need to make sure that we are responding. The challenge this year has been a couple-fold. Not only have we been with a pandemic, but we tried nationally to do this a little easier. For myself and some of you who are used to online and picking up a laptop or a phone, easy, right? My2020census.gov. It literally takes us 6 minutes, 10 questions. But for some individuals who haven't gotten their mail, maybe not to pick on my mom, but she is later in life, doesn't have a computer. She was a little concerned and confused. Informed her, you can do the phone. So you should have gotten a mailing at your house, and you should be able to call in. So phone, mail, and if not, during COVID, we haven't been able to, until the last 3 weeks, send someone to your door. So as we've sent someone to your door, we are hoping that you'll answer that door now. And so if you go to the next slide, you'll see, you get to see all kinds of persons counted. Initially, it was April 1st with the deadline of July, mid-July. The tally is based on, believe it or not, who was in your home as of April 1st. Until a couple weeks ago, we had extended through our congressional leaders and the administration, we were hoping through the end of October. They changed that. We have 1 month today to count Delawareans. So if you have had foster children, other adults in your household, those of you who had your college children come home, count them, count them. The neat part that I like to emphasize to folks is it is private, it is confidential. You don't have anything to fear. No one will be getting this information, but what it does, it tells us in our state and across the country where we're putting our resources. So it's your name, your age, your birth date, origin, your gender, and then the number of persons in your household. Literally 6 minutes or less if you do it right and quickly. And the really important piece for privacy, if you were ever to be asked, and you're not, about your Social Security information, they're not going to ask. They're not going to ask for money or donations. And the last bullet point is really important in our community and in our state. They're not going to ask you citizenship status. So again, every child, every person needs to be counted. And you would be so pleased with the leaders and our community partners who have planned this out. And Governor, we had over 300 events planned. We haven't been able to go out. So we're going to need you. You're going to see that I already mentioned the high investment in dollars in Delaware. Our political districts and our funding for our social services are so important. But we lose money, and we need your help. If you look at this figure, we lose our estimated $10 million a year if we use the former census data from 2010. That has accumulated to up to $100 million. So again, to our roads, our transportation, our school lunch money, our health care, our schools. So please don't be undercounted. When you undercount, we lose out. And it isn't just our high-risk communities and our children, but it's also our veterans, our parents, our neighbors. So for the state, it's really important. And if I had my members of the Complete Count Commission here with me, they would be echoing that too. It's up to each and every one of us to count. These have been very divided times. This is a way we can be united. The census unites us. So the number before you shows a little bit of a lower response rate. Delaware is lagging. We have 1 month to up that figure. Governor, I'm like you. I'm optimistic. When people in Delaware put their mind to it and they get behind something, we can do it. We need to raise that number to around 80%. We are at 62.2%. We're below the national average of 64%. However, we have glimmers of hope. If you look at the other slide, you'll see that Kent County is the highest right now in the state, next to Newcastle, of course, too, with response rates. But we've got to do better. In our southern county, Sussex County, we are really running low, and particularly in our eastern Sussex area, we're down and around the 51%. If you come back up here where we are today in the city of Wilmington, we also have a lot of work to do. We're still running around 52% in certain districts, 62.8% in others. Newcastle County, I know, has put a concerted effort also partnering with us, and they're coming in at 67.5%. So the takeaway message while we're here today addressing this pandemic is also let's address long-term infrastructure for our state. If you're with a nonprofit, if you're with a youth sports club, if you're a faith-based leader, wherever you might be, help us up the count, help Delaware raise the numbers, and bring in the resources that we need. Easy again, we're going to leave information on the screen that will be available for you to go to mycensus2020.gov. The incredibly helpful thing is that not all of us are English speaking as our primary language, so we have multiple phone numbers that you can dial, and in your own language, your own dialect, you will be able to speak to someone. And so again, to our friends that I know the governor and I have visited a lot in Western Sussex, who are predominantly Haitian Creole, we have a line for you. For our good friends here in Wilmington, the LACC and other partners, we have the Spanish line. So we just really hope that you pick up the phone, you call, and you also visit our website, which is census.delaware.gov, or one of our handles that we have at Delaware Counts. And again, kudos to our team. I want to mention that Delaware was selected as one of a handful of states for the work that they did in their website and has received national recognition. So I want the hard work that a lot of these folks put into it to be recognized, and really work with the governor and the administration to get that number up. And to our federal partners, Senators Coons, Carper, and Congresswoman Blunt-Rochester, who've also spent a lot of time on this to make sure that we get our numbers higher in Delaware. So with that, Governor, I am pleased to give you our update and again, encourage those listening to help us out.
Thank you, Bethany. Thank you, Madam Lieutenant Governor. Let's get counted, Delaware. Come on. Some of those jurisdictions are falling behind. We need some kind of competition. I don't know what kind of prize to come up with, Jamie, that we could give everybody who lives in a particular area. Maybe less COVID-19, I guess, if that could something that could be accomplished. Certainly, we know what it takes. So we've talked today about the census, so critically important. Everybody needs to get counted, so call those phone numbers that were up on the board. We talked about hospitality and changes that would affect restaurant, bar establishments in the beach areas of our state. We talked about sports, which everybody loves and cares about. And it all boils down to one thing: face covering, face covering, face covering, and a little social distancing. If we're able to do that, we're able to win over the Labor Day weekend, get off on the right foot as we move into the fall with lower case counts, lower positive case counts, get more children into classrooms, more athletes out onto the field, and a safer and healthier community with more people back to work and more businesses opening. And it really comes down to one thing: everybody making some little sacrifice with wearing a face covering when they're in public and being cautious, particularly around other folks in large gatherings. So with that, I want to thank everybody for joining us today. We have some press in the room. I see Sarah, if she wants to come forward, if she's good. And we have some pre-submitted questions as well. So thank you again to our Lieutenant Governor. Thank you to Jamie Mack. We'll have Dr. Rattay, Carol Rattay is the Director of Division of Public Health, probably back with us next time. And A.J. Shaw, the Director of the Delaware Emergency Management Agency. Sarah.
How are you, Governor?
Good.
So, related to the business violations, to be clear, are you seeing more businesses or fewer businesses, I guess, violating these state of emergency orders as the pandemic has dragged on?
As we've continued on, I think we've seen increased compliance. We've gotten to the point where, the educational visits have had a lot of impact. We've had several places where we recognize, okay, we've gone back a second time, we've seen improvement. We've even got, some feedback from the folks that have initially sent us complaints that upon further visits that they've seen improvements as well.
Okay. Governor, under your state of emergency, the state is allowed to take longer to respond to Freedom of Information Act requests. What is the purpose of the FOIA remaining on hold, and when will the state revert back to previous requirements?
Yeah, so that's an issue I'm happy to bring up with our legal folks. It's not something that I pay attention to on a day-to-day basis. It's obviously very important, certainly in the work that you do. So I don't have a good handle as I sit here with respect to what might be backed up and the like. Essentially, though, the purpose of it is we have our whole legal team working on these issues that we've talked about today, and the amendments to the executive emergency declarations, which we just had one this week, and a whole sundry list of things. And so it's just an issue of the time available to do it.
Thank you.
Mm-hmm.
All right, first question's from Melissa Steele at Cape Gazette. Is voting by mail going to continue now that the GOP filed a lawsuit against its constitutionality? Should people plan to vote in person? What happens with ballots that have already been turned into the election office?
Yeah, so vote by mail is the law. It passed in the Senate with bipartisan support, passed in the House, I think maybe more along party lines. It is underway. People are voting as we speak. I would encourage people to vote by mail because it's safer, particularly if you're a senior citizen or part of the vulnerable groups to COVID-19, some kind of compromised health situation. It's just a lot safer. And if there's ever a time, and by the way, the legislation that allowed for vote by mail only applies to the elections this year. And so it's something that we'll learn more about. But the basic guidance that I would tell people is fill out your ballot and get it in soon. We've got primary coming up because the reliability of that delivery, if you let it go to the weekend before the Tuesday election, you might run into a problem. So I would get that ballot filled out, get it in the mail. It is the law. It will be processed.
The next question's from Sean Green at WDEL. Governor, you said it was not your call, but rather the DIAA's decision when it comes to fall sports being played in season. Has the high school athlete parent group letter campaign changed your opinion?
Yeah, so I did say that, and I still believe that. DIAA is a body that consists of coaches, athletic directors, superintendents, members of the public, folks that know high school sports in our state and the various sports activities that are ongoing. They know the situation in their individual facilities and school districts, and so ultimately they must make the decision. What we've come out with today is an update of the public health guidance around how to play those sports and play them safely. And I know DIAA, when it made its original judgment decision on sports in the fall, made it on the basis of a whole series of criteria, not just the public health criteria. My guess is that they'll take another look at it. I would encourage them to take another look at it with the new guidance that we're providing today, and to see whether or not, first of all, each of the sports either have to abide by the guidance, which essentially is wear a face covering, particularly in the high-intensity, high-risk sports like football, rugby, wrestling, and to be able to figure out with like a coordinator to figure out how do you handle the off-the-field activities with spectators, comings and goings, and that in facilities. So there's a lot that goes into it. DIAA will have to consider the new guidance coming out of public health in the context of its prior decision. I think everybody, including the parents whose letter I saw, want to see more athletes get on the field sooner. We know how important it is to the athletes and their families. We know how important it is to their health, their mental and physical health, and what an important thing. As a former athlete myself, I know how important it is and was to me as a high school sophomore, junior, or senior, particularly those seniors, that they don't want to miss their season. So in that sense, there's a lot at stake for those folks. The letter from the parents, it just reinforces my view that this is an important activity, that we can do it safely. We just now know that some of those high intensity sports we could do safety. I personally was not as convinced as I am now, having seen what Jamie Mack and his team have come up with and talked to some of the coaches in that area. But we've got two kind of big decisions in front of us, and that is how to get athletes on the field and how to get students in classrooms, and we need to keep working on it.
All right, this is the last question for today from Sean Green at WDEL. Maryland Governor Larry Hogan recently gave his state districts the green light to consider in-person learning. Is that something you would consider here even before getting 2/3 of your formula to green if there are educational issues with the remote or even hybrid model?
Yeah, so I'd like to get more students in a hybrid model situation. Most districts are not. They're fully remote. If we could put up on the board the school reopening gating criteria that shows that we're in the yellow category, you know, we're going to stick to those metrics. And they include new hospitalizations, they include percent positives, and they include new positive cases. We have 2 yellows and 1 green. The green, we're pretty comfortably under the daily hospitalizations. The goal to move the percent positives to a green, we need to get the 4.5% down to under 3%. That's achievable, but we're at the moment moving in the wrong direction. We've got quite a bit to go to get new cases on a daily basis down under 61. Needs to be down under 10. But we can get two of those 3 gating criteria up to green, and so would allow fully in-person instruction. But I don't intend to deviate from the criteria we've established. It's something that we've made public. It's something that superintendents and board members have made a decision on. I would like to see more districts in more of a more hybrid, more in-person instruction, like some of the districts. Cape Henlopen, I think, is the district that has the most robust. They provide choice for families and students whether to go remote or in a hybrid mix, and you know, I'd like to see more of that. That's the next step, I think, and I know that superintendents are thinking about it in those terms. I hope they're using this time while they're in remote instruction to think about how to bring some of those students back into in-person instruction in more of a hybrid model. But I think the question was that Governor Hogan, notwithstanding the criteria, wanted to see more students in classroom. I can understand that desire. I think everybody has that same objective, but we've set out the metrics under which that can take place, and we're going to stick to it. Our goal now is to get more children in front of teachers in the classrooms. So with that was the last question. Again, I want to thank our Lieutenant Governor for joining us today. Thank her for her work, particularly among the homeless in Delaware through this COVID-19 pandemic, and her work on the census. We need to get everybody counted. So if you're falling behind out there in Wilmington and Sussex County, come on, let's get on the ball there. Let's get counted, fill out our forms. So that we get our due. To Jamie Mack and his team, thank you for stepping up your enforcement, getting better compliance. We're seeing it across our state. But at the end of the day, it comes down to us. Each of us as Delawareans, as parents, as sons and daughters of parents and grandmothers and grandfathers who are most vulnerable. For all of us to wear face coverings when in public, to follow the guidance when we're in a restaurant. If you're a young adult, we really need you to step up to the plate, because that's where so many of the new cases are coming from, and it's coming from activities that need to be curtailed. Whether you're at the University of Delaware on an off-campus party or in a restaurant or bar, and it's later at night and things are getting a little bit looser than should be the case, or whether you're just in a neighborhood gathering with 30, 40, or 50 people and with no masks wearing or anything like that. All our efforts centered around getting people back to work where they have a livelihood to support their families, whether it's getting students back in front of a teacher in school with in-person instruction, or whether it's getting athletes back on the field. We can affect whether we can do that or not by following the rules, following the guidelines. Every governor across the country has admitted how important it is to do appropriate social distancing and mask wearing, whether you're in Arizona, Florida, or Texas, or Maine, Connecticut, or New York, or anywhere in between. Those are really simple things that each of us can do, and in doing so, we'll protect our neighbors and be able to get folks back to work and children back in school. Thanks for joining us today.